All right, Mr. F, we're going to continue with our exam now. We already did the head, ears, nose, throat, cardiac, and pulmonary. We're going to move on. We're going to do an abdominal examination. We're going to do a musculoskeletal examination, and we're going to do a neurological examination. Now, we did do a large part of the neurological examination when we were doing the head, nose, ears, and throat. We did all the cranial nerves. We did cranial nerve 1. Which was the olfactory nerve. We smelled some coffee, did a sense of smell. We did the optic nerve with the visual field test and the Snellen eye chart. We tested cranial nerve 3, 4, and 6 when we were doing our cardinal fields of gaze and random eye movements. We did the facial nerve and the trigeminal nerve, which are cranial nerves 5 and 7. When we were making different faces and we had different semblances of touch and feel on the face. We did cranial nerve 8 when we did the Weber and the Rhine test for our conductive and sensorial hearing. We did cranial nerve 11 when we shrugged our shoulders to see if we had, that's the accessory nerve, to see if we had strength. We did cranial nerve 12 when we stuck out our tongue and it was midline and the uvula lifted nicely. Now we're going to proceed on to an abdominal exam. Do you mind if I disrobe you? Okay. And now you're going to just lay back. I'm going to keep this covering your legs for now so we don't need anything on the legs. All right. I'm going to start with inspection of the abdomen. We're going to see if it's distended. We're going to see if we can see any peristalsis or anything like that. We're going to see if there's any lesions, lumps, bruises, anything like that. When we came in, we observed Mr. Farley come in, and we saw that there were no signs of him acting guarded or anything like that. He reports no pain. So we inspected. Now we're going to move on to auscultation, which is the only exam that you move right to auscultation instead of palpation and percussion is the abdomen, because if there is something going on in the abdomen, you could restart peristalsis if you moved on to the palpation or the percussion. So we're going to check all 4 quadrants of the abdomen. Okay, and we're listening for abdominal noises, and they'll be active or hyperactive or non-existent. And right now I am hearing active bowel sounds in all 4 quadrants. Now, while we're auscultating, we're going to auscultate the aorta and the iliac arteries. You can attempt to do the renal arteries, but because the renal arteries or the kidneys are retroperitoneal, it is sometimes difficult to auscultate. Okay, and we're checking to see if we hear any sign of a bruit, and then we're going to go to the clavicular line and then check the iliac arteries. Okay, and then there is no sign of bruit or any turbulence, and the bowel sounds are normal. Now we're going to move on to percussion, and I'm going to percuss all 4 quadrants of the abdomen, and over the digestive organs I expect to have a tympanic sound. As I get up a little bit higher to the liver and spleen, I expect a little bit of dullness. Okay, so now we're going to start at the umbilicus, and we're going to move up and left, and we're going to try and see if we can find the border of the spleen. Okay, now we're getting dull, and now we'll start the mid-clavicular line, and we'll work our way up and see if we can find the liver. Okay, and we get a dullness, I would say about 3 centimeters below the costal margin. All right, now we're going to start with soft palpation. Okay, so what I'm going to do is I'm going to start, and I'm going to gently press on your stomach. Tell me if you have any pain or tenderness. Here we're observing to see if there's any guarding. We're not going very deep. We're going to do it with one hand. We want to make them comfortable. Okay, and then when we move on to deep palpation, we're going to use 2 hands. We'll go a little bit deeper. But we're going to go, we're going to touch, we're going to see if there's any signs of guarding or tenderness. And I'm going to go and do it throughout the entire region. All right. And now we're going to do a little bit deeper. So we're going to push a little bit harder. And we're going to roll. And we're going to feel, if we can feel, we're going to move up until we can feel the liver. Okay, and I can feel the border of the liver right there. I'm going to do the same thing with the spleen. Often the spleen is not palpable because it does sit under the rib cage. Okay, and now we're going to test for any rebound tenderness. So if you had appendicitis, you will push down, you may feel pain, and then when you lift up quickly, you feel more pain. All right, do you feel any pain when I push down?
No.
Okay, and I move up quickly, he has no rebound tenderness. Other ways of testing for appendicitis will be a Sody's test, where I push down here, put a little pressure on the leg, and have him ask him to lift his leg. Okay, and he would feel pain. Okay, actually lift your knee straight up. You're not, so you're going to lift up that way. So ability to resist. Okay, go ahead. Okay, and he feels no pain. All right, so now we've inspected, palpated, auscultated. I can try to palpate the kidneys, but because they're retroperitoneal, you would have to reach behind, lift, and palpate very deeply. I do not actually feel them on Mr. F. Okay. Now, Mr. F, we can sit right up. I'll help you with that. Okay, now we're going to move on to our musculoskeletal, and a lot of this will include the neurological too, because the nerves that innervate the muscle movements are, part of the neurological system. And so when you're making your movements, we're going to assess your range of motion right now. So we're going to start by abducting. And I'm going to adduct, and you're going to cross right over. Okay? And then you're going to do flexion, you're going to go straight up. Okay? And then you're going to do extension. Okay? And now put your arms out. Now we're going to do pronation and supination. Okay? And now I'm going to palpate his shoulders. You can put your arms down. Okay? And I'm going to start at the clavicle. I'm going to work my way back. I'm going to feel for the joints. I'm going to feel for where the tendons and the muscles innervate. We're going to follow the deltoid down to where it goes into the bicep. I'm just going to raise your arm up like this and rotate this. Oh, we're going to bend the elbow a little bit and rotate this out here so I can just feel this joint. You're going to do this both bilaterally, and you want to feel the joints. You want to feel if there's any looseness in the joints. You may have a lax tendon or ligament. Okay, we're going to do the same thing on the other side. All right, and I'm going to do the same thing here. We're going to feel it. All right, and now we're going to test your strength. Okay, so we're going to, can you lift up against my abs? Okay, good. Can you push down against my abs? Good. All right. Now we're going to check your elbows. We're going to move down to the elbows. We're going to inspect the medial and the distal condyle and the bursa. And we're going to check and we're going to feel where the ligaments and tendons are attached and see if there's anything different. Torn ligaments would present with a bump or a lump maybe. There would be bruising. Okay, we see nothing here. Okay, so now we're gonna stick our arms out. We're gonna bend up, flex, and extend. Okay, and we already did pronation and supination. Okay, and now let's bend it towards you for strength. Okay, and now to push. Okay, good. I won't push that table too much. All right, we're gonna move down. We're gonna check our brachial pulses, and we're gonna do them both at the same time. And they are both +2 and bilaterally. I'm gonna move right down to the radial pulses since I'm doing pulses. They are also +2 bilaterally. I am inspecting the arms as I'm going down, seeing if there's lumps, lesions, bruises, anything like that. I'm gonna look at the wrists. I'm gonna palpate the wrist, palpate the tarsals. All right. And while I'm doing this, I'm observing to see if there's any signs of pain on Mr. F's face. Okay. All right, we are good there. Now we are going to move on to the lower extremities. So for now, we can just cover you back up. Move on to the lower extremities. Okay, I'm going to ask you to stand for 1 minute. We'll help you with that. Okay, and we're going to turn sideways a little bit. And you can lean on the table with one hand. But I'm going to want you to move your hip, your leg forward, down, and then back. Okay, and then we're going to do it with the other leg. Forward, down, and then back. All right, and now we're going to do outward to the side. I'll move out of the way. Okay, and then you're going to turn around to do the other one out to the side so we don't kick the table. All right, and now we're going to, you can stand right this way. We're going to cross one leg over the other, and then do the opposite. All right, now we can sit back on the table. Okay, so we did check the range of motion of the hips. Now the knees, we're going to do the same thing. We're going to extend them. So straighten your legs up, and then bend them, and you're going to bend back as far as you can. The table's going to restrict you a little bit there. All right, and I'm going to feel the knee joint. I'm going to palpate. I'm going to see if there is any feel of water. I'm going to check the gaps in the joints. I'm going to check the popliteal pulses while I'm here. I'm also checking the ACL and the MCL to see if they seem to be intact. All right, and now we're going to move down. We're inspecting the legs as we go down. Which ankle is
This one.
this one?
This one.
Oh, this one. Okay, so Mr. F does have a current ankle injury with some tendon damage. So we're just going to check some pulses here. Okay, and can you flex your toes all the way down? And then up, dorsiflex them back up, okay? And now can you out and in? Okay, any pain or tenderness with that?
Little on the left.
Okay, and now how about against force? Up. How about, okay, down. All right, now we're gonna, okay, so we did the upper extremities, we did the lower extremities. I'm gonna ask you to stand up one more time, and I'm just gonna take a look at your spine. Okay, that is good. Can you bend over and touch your toes? Okay, oops, okay. I'll move that back on, and then when you stand back up, hyperextend back as far as you can. I'm gonna, yep, okay, good. All right, we can throw this back on. I apologize for that. Always want to provide for the patient comfort. All right, now you can have a seat again. Okay. So now I'm going to do some random movements of the hands. So I'm going to ask you to put your hands on your lap like that. And I want you to flip them. Okay. So we're observing there to make sure that he can do it in a constant flow pattern. He's not interrupted. That inability to do that may show signs of a cranial injury. We're going to do the heel to shin test. So I'm going to ask you to pick up your heel. You'll start with your right and just run it down from your knee to your shin. Yep. All right. And we'll watch that, and any jerky motion or anything like that may be a sign of cranial injury. Okay. We're going to check for superficial pain, and we're also going to check for vibration. So superficial pain, I'm going to ask you to close your eyes. All right. And I am going to poke you with an object. Okay, there are going to be three forms. There's sharp, can you feel that? Mm-hmm. Okay. There's dull, and there's soft. Okay. So at first when I do it, I just want you to tell me where I touch you. Okay. Whether it's the left or the right, the arm, the leg, the face.
The left arm. The right knee. The left shin. The right shoulder.
Okay. Now I want you to tell me if what I'm pricking you with is sharp, dull, or soft.
Sharp. Sharp. Dull. Soft. Sharp. Sharp. Dull.
Soft. Okay. Now we're going to check for vibration sensation. So I'm going to have you put your fingers out here. I'm going to put this, I'm going to ask you to close your eyes. Okay? And I'm going to put this on your finger, and I want you to tell me when you feel the vibration stop.
It stops.
Okay? And do the same down on your toes. Can you feel the vibration?
Stop. Stop. Stop.
All right. If at the most distal joints he did not feel it stop, I would move up more and more proximal, and that would give us an idea if he had a peripheral neuropathy. All right. So now we are going to go to do some reflexes. Can you wiggle your foot up and down a couple times for me? Okay, good. Okay. All right, so we felt reflexes at the biceps, the triceps, the forearms, the patella, and the Achilles. All right, I ask you to close your eyes. I'm going to trace a number in your hand and tell me if you can tell me what it is.
Eight.
Yep. All right, I'm going to trace something on this hand. Tell me if you can tell me what it is.
An H.
Oh, it was an A, but very, very close. All right. Now I'm going to place an object in your hand and you see if you can tell me what this is. You can close your hand.
Teaspoon.
Yep. All right, now place another object in your other hand, see if you can tell me what it is.
AirPods.
All right. So those are what we need to do sitting. Now we have a couple that we are going to do standing up. We're going to stand up and do the Romberg. All right. So I want you to put your feet together. Okay, and stand with your arms crossed at your chest. Okay, we'll just stand like that for about 20 seconds. All right. And then we're going to close our eyes and stand there. All right. And here we're watching for any wiggling or moving or instability. We're going to see if he can maintain his balance. And he's doing fine. You can stop. That's okay. Good. All right. And now we're going to do the pronation drift. So we're going to put our hands out in front of us with our eyes closed. All right. All right. Good. And he can keep his arms up. Okay, you're good with that. Now I just want you to take a couple steps towards the wall, turn around and come back towards me. Okay, can you stand on your toes? Can you rock back on your heels? Yeah. Well, I know you have a bad ankle, so just, okay. Okay, excellent. So we did the Romberg, we did the pronator drift, we did the heel to toe. You can have a seat again. All right. I think we covered everything we needed to.